This DVD shows the procedures to be followed when administering Herceptin subcutaneously using a handheld syringe. Subcutaneous Herceptin is supplied in a ready-to-use formulation with no additional requirement for dilution. The vial requires storage in a fridge maintained between 2 to 8 degrees Celsius. The maximum time the vial can be kept out of the fridge is 6 hours. Wash your hands before starting the procedure. Check the expiry date on the vial and make sure that it's intact. The solution should be clear and colourless or slightly yellowish. A 21 gauge needle should be used to draw up the contents of the vial. The needle should then be replaced by a 25 or 27 gauge needle for subcutaneous injection. Any excess volume over 5 ml must be discarded from the syringe following your local procedures. This 5 ml will contain a fixed dose of 600 milligrams of Herceptin, the required subcutaneous dose irrespective of patient weight. Patients can be seated in any comfortable chair or bed, with their leg fully extended and the upper thigh exposed. The best site for the injection is the anterior thigh, midway between the patient's hip and knee. When choosing where to inject, you should of course avoid any moles, scars, bruised or tattooed areas. Wipe the chosen area with an alcohol swab and allow this to dry thoroughly. The needle must be fully inserted into the subcutaneous tissue, but not into the underlying muscle. Pick up a fold of skin and pinch. The needle should then be inserted at an angle of approximately 30 degrees. The drug should be administered fairly slowly and at a rate that is comfortable for the patient. The administration time will be approximately 2 to 5 minutes. If the patient has any pain or discomfort, try easing off the pressure on the syringe. If this doesn't help, stop the injection and wait until the patient feels ready to continue. When you've completed the injection, hold the needle in place for about 10 seconds to minimize any leak back from the site. You can then remove the needle and safely discard it with the syringe according to your local guidelines. The patient should now be monitored. Check and record any irritation seen and observe the patient, reporting any other administration-related reactions. Please ask your local Roche contact if you'd like to receive additional information about subcutaneous Herceptin.